During the COVID-19 pandemic, children and families have experienced losses in a variety of ways, ranging from a loss of time in school to parents who have lost jobs and a loss of social activities and connections.
When sudden changes and challenges occur, it is normal for children and youth to have strong reactions to their circumstances. Emotions like anger, fear, grief, anxiety, helplessness are normal.
During times of stress and challenge, children and youth often look to adults in their lives to help them navigate uncertainty. One thing kids need to be able to do successfully is learn to manage their emotions. Children and youth may find it hard to learn these skills as they grow unless they have a caring and supportive adult in their lives. Adults are key to helping them to learn, identify, and express their feelings, just as they would teach a child to tie their shoes. When children learn how to identify and manage their feelings, they build a strong foundation for mental health, wellness, and relationships throughout their lives.
Children and youth may have mental health concerns for a variety of reasons. Children also may experience trauma or adversity in their environment, such as abuse, neglect, domestic violence, community violence, or a parent who struggles with substance misuse.
You can be a natural support for a child, and these natural supports come in all colors, shapes, and sizes. You don't need special training to support a child, but it's important to be aware of the warning signs that signal a child or youth may need help. The two most common signs are extreme behavioral changes, such as the child being aggressive or withdrawn, or significant changes in their grades.
If you have a strong relationship with a child or youth, let them know you're worried about them and ask them how you can help. The most important thing you can do is listen without judgment. If you see these signs or others, it's important to ask the child if you can share your concerns with their caregiver. This way, a child can get support from a mental health professional who specializes in children.
If you're a caregiver and you are concerned about your child's behavior, a good place to start is to contact the child's pediatrician. If the pediatrician does not have specialized training, ask for a referral to a mental health provider. For a list of doctors who have received specialized training in mental health concerns, please visit the Healthy Minds Fairfax website.
One of the best places for information about resources and support for your child is from their school counselor, social worker, or psychologist. To contact any of these individuals, check with your child's school website or call the main office to be connected to the appropriate person.
If your child is experiencing mental health crisis, call the Children's Regional Crisis Response, also known as CR2. Youth who feel suicidal can call or text Crisis Link. Both services are available 24 hours a day, 7 days a week, with crisis counselors available to talk.
When it comes to youth and mental health, remember, the most important thing you can do is listen to your child and watch for any changes in their behavior. When a child or youth knows there is a safe adult to support them, it can make all the difference in their lives.